to this episode of the ASHA podcast. I'm Fred Wyant with the American Sexual Health Association, ASHA. Over the summer, we had some pretty big news on the STI prevention front when CDC released guidelines on the use of Doxy PEP, which involves taking an oral dose of the antibiotic doxycycline as post-exposure prophylaxis PEP within 72 hours after sex to prevent bacterial STIs. And it's really effective. Studies show that Doxy PEP can reduce the risk of contracting chlamydia by 88%, syphilis by about 87%, gonorrhea by around 55%. And it's really important. It's our first major new prevention tool in a while. CDC's guidelines call for the use of Doxy PEP with specific populations, such as men who have sex with men and transgender women who have had a bacterial STI in the last 12 months. And the focus is on these populations because they're the ones who had the most success in clinical trials that study Doxy PEP, and also because for a variety of social factors, they're particularly vulnerable. So it's really important to reach people who need it the most. And if you want to learn more about that aspect of Doxy PEP, we're going to link in the show notes to a conversation we had with one of the co-authors of the guidelines who really gets into all of that aspect and where we might be going in the future with other populations, because this will probably be used more broadly. But our guest today is Jaylan Daniels. He is a graduate of NYU Silver School of Social Work, and he has experience taking Doxy PEP as part of his own healthcare regimen. So he's going to help us navigate all this from the patient perspective, which we think is incredibly important to get that voice into the conversation. So, Mr. Jaylan Daniels, thank you so much for taking time to chat with us.
Hi, Fred. Thank you for having me. It's great to be
Yeah,
here.
this is long overdue. So I'm just going to dive right into it. What was it that led you to decide to take Doxy PEP?
Yeah. So I think like to what you were describing, I saw on Twitter, social media, how Doxy PEP is being introduced as a PEP for exposure to certain STIs. And I thought, okay, well, as a person who fits those guidelines, I should also be taking that medication.
Yeah, like I said, I'm curious, did you initiate the conversation or did your healthcare provider start it?
Yeah, so so I did initiate the conversation with my healthcare provider. I just asked him if I could start taking PEP and the Doxy PEP, and he said, "Yeah, sure." I think what's great what I appreciate is that I have uh, a doctor who works with the LGBT population, so it was very easy to ask and to get the medication, especially because there's just a level of comfort that I have and trust in him that like he will provide me like with what's needed. That makes sense.
Yeah, it does. And I'm glad to hear you say that it was easy for you to have this conversation, but that makes me just sort of brings me back to the idea that these conversations for a lot of people maybe aren't so easy for a lot of reasons. I mean, talking about sexual health can be uncomfortable just in general, sex, that can just be a hard thing to bring up. Um, and I'm just curious, what's your advice for somebody who might want to engage with their healthcare providers about Doxy PEP, but they don't know how to bring the subject up, or maybe they don't feel as comfortable. They may not have a relationship like you do with your healthcare provider. How do you suggest they kind of break the ice?
Yeah, that's a good question. I can understand and empathize. I've had like different primary health care physicians over the years, like COVID and things change and this and that or whatever, insurance. And I've had uh primary care physicians where I did feel kind of like hesitant about bringing up things, and it wasn't because of like my own feelings. It was just that maybe I didn't know that if they knew the answer to the questions, or if like my last provider, if she would know what Doxy PEP is, or even if she knew like that the new CDC guidelines were. So I think there is a level of like cultural competence that like has to take place for someone to feel comfortable, at least for myself. Um, in terms of like getting like making that first step. I mean, if they can't switch providers to someone who is like, like a more culturally competent LGBT healthcare, or just, healthcare in general, then I think I would start with maybe that's like getting the facts about what's going on, like the facts about Doxy PEP. saying that
Yeah.
like this is the CDC guideline, like this is like the guidelines for me. I fit these guidelines. Like, can I get the prescription for this?
That's a really good point. Because we've in some of our public health campaigns, we've always said that an informed patient is an empowered patient. And I think that you're exactly right. Yeah, sometimes you have to maybe educate the provider a bit on these things.
Mm.
And the best way to do that is to understand it yourself. And yeah, that's a great point. I'll just do a plug here. We have some patient education materials on our website, like a Doxy FAQ, and some videos and things that are meant to do exactly that, to really get them up to speed. So I think that's a great point. Yeah, it's if patients understand these issues better, they'll probably not only talk about them more effectively, but they'll feel more confident bringing them up in the first place. That is great. Um, Let me ask you, I always wonder about the real world experience with any prevention strategy, like side effects. And is it hard to remember to take the dosage? How has that been for you, if you don't mind my asking?
Yeah, for me, side effects, I haven't really had any negative side effects, like no nausea or vomiting or headaches or anything like that. I mean, whenever I do take the medication, I usually do take it like while eating food. I'm not sure if that is a part of the guideline, but maybe that's maybe why I'm not feeling nauseous. Um, yeah, so far as side effects, I don't really experience any side effects, and remember to take it can sometimes be a little bit difficult depending on the circumstances, but I usually try to take it the next day or even the night of, but yeah, most of the time the next day. And it kind of works. I mean, if I'm feeling like I won't remember, then I'll set an alarm just to make sure that I actually take it the next day. Or if not an alarm, then a reminder, I should say, a reminder. So like, okay, like I need to remember to take this.
That's a good idea. And yeah, I'm not surprised to hear you say that you're not really experiencing much, if anything, in the way of side effects. I think doxycycline is generally pretty well tolerated, but I'm glad, again, this is why we wanted to talk to you, so somebody who's actually going through this. Um,
Mhm.
so back to CDC for a second. So when they came out with their guidelines back in June, they just had all sorts of statements and this and that came out about it, understandably. And one of the things they said is that using Doxy PEP should be part of like a broad, holistic approach to prevention. So patients also need to be counseled about condom use and STI testing, along with any vaccines that might be appropriate, and linkage to HIV related services is appropriate. One point about that stuff came out to me is like, so the guidelines on doxypep call for bacterial STI testing when the treatment begins, but then again every 3 to 6 months. And so this is kind of a follow-up from the last question. Do you think is that how difficult is that, going in every 3 to 6 months? Do you have any suggestions on how we get the message across in ways that people actually do it? Oh, I got to go for testing every few months. Yeah, but I mean, I'm just curious how that's been for you and what you think about that.
Yeah. I mean, for me, I haven't really had an issue with the follow-up. I think that, like you're saying, that it is a part of a broader um healthcare, like prevention healthcare, right? So I think that like if someone is taking Doxy PEP, they're also probably taking prep for HIV or maybe HIV medication or these other things, right? To treat HIV or to prevent HIV. So if you're getting like the injections every 2 months to prevent HIV or to treat HIV, then you're already kind of getting that you're already doing the testing for STI. Well, you're doing the HIV testing, but you can just add another testing panel for STIs, right? Or if you're getting prep the pill every 3 months, you're already going in for HIV testing. The provider can just add another panel for STD testing. So if you're in a way, I mean, I think that's what I think about it in my head is that, if it is a part of your broader like sexual health like prevention care, then there's mechanisms in place where you're getting these testing done. So it's not solely for this, but I do understand that, like, going back and getting testing and doing this is still like a little bit difficult. So I think anytime you can do it from home, like anything that you could do from home would be helpful, but I'm not sure how reliable that
Yeah,
is.
yeah, those are really great points. Because another thing CDC has said this year is that they realize that as part of their really all of us who are working around STI prevention, that we have to think about doing a better job of meeting patients where they are. So I think we will see more. I don't know. I'm like you. I don't know how this maybe applies specifically to Doxy PEP, but in general, sure, more mobile clinics, more pop-up clinics. At-home testing as appropriate, that kind of thing. I think there is a general move to recognize that we need more of that just to help just make things a little more convenient for people. And you touched on something that I didn't even think of, which is why I'm so glad I got to talk to you.
Mhm.
Yeah, you're right. So the follow-up testing every 3 to 6 months, that just doesn't have to be something that exists in a vacuum. Maybe you can sort of, add that onto other services and other care that you're receiving and sort of do it like one-stop shopping is not the right term, but I think you know what I mean. I hadn't even
Right.
thought about that. And so I think that too is another good point to get across to people. Look, this doesn't have to be, some big thing. You can just do it when you come in for this or for that. We can maybe take care of things all at one time and make it as convenient as possible. Um, yeah,
Right.
very good. See, that's why I need to talk to you.
I'm
All right.
glad you got some insight.
So one of the hot topics in STI prevention is equity, realizing that certain populations like young people, communities of color, LGBTQ communities, they're especially vulnerable when it comes to STI risk. It's not because they're doing anything differently, really, it's through no fault of their own, but it's just that a variety of economic factors, of social factors just really play into that. But also the healthcare systems haven't always been welcoming or really sensitive to the needs of these patients. And I'm just curious, what you would like to see health systems do to better meet the needs of populations that haven't always been treated well, especially MSM and transgender women.
Thank you for that. I mean, I think without, suggesting a complete overhaul of the American healthcare system, I think that, one of the steps that the healthcare system can do is like we were talking about earlier, meeting people where they are at. If it's whether it's like, like we were talking about earlier, like the mobile kind of clinics or
Mhm.
either through like social media, using social media as a tool to like get information spread information. So maybe it looks like making Instagram advertisements or, like collaborating with creators on TikTok to really talk about like certain guidelines or, new
Mhm.
medications like Doxy PEP or HIV treatment or HIV prevention treatment. Um, to have like the the conversation meet people where they are, so Instagram or TikTok or Twitter and on these other places, but then also having let me think of a saying, like again, I don't want to like overthrow the American
Sure.
system, but like making sure that or ensuring that physicians are like have some type of like training or whether they're new physicians or some type of like ongoing continued education surrounding like the sexual health of like LGBT
Right.
populations and and
I
I
mean,
hate to say just more outreach because like I mean obviously outreach is happening but I don't know if it's reaching the right population, right? So like like some type of like authentic like campaign that works and feels natural to people. I,
mhm.
and if I had the idea, I bet I'd be a millionaire now.
Buddy, you and me both. Yeah,
And so,
no, I think you've got it right, and you're exactly correct. This does get back to that idea of reaching people where they are. And you know what? You mentioned the importance of social media. What I'm going to do in this conversation with you is we will edit out 5 or 6 reels where you're answering, like some key nuggets of information that you're talking about, and we'll use that on Instagram. We'll use that on
mhm,
X and Facebook or wherever we can put it.
mhm,
Because that's really it's really important to reach folks, especially younger people, who are so active on social media. And Jaylan, it's become more apparent to me that beyond, when we talk about, well, why are there health inequalities? They're the well, it can be like a lack of insurance, or people don't have money for copays and things. And all that's very true and important. But, what about stuff like if your job won't let you have paid time off? You may have to choose between going to a medical appointment and an afternoon's pay.
Right.
What about transportation issues if a clinic's not convenient? What about childcare if you've got kids that need to be
Mhm.
watched? There can be a lot of stuff like that you don't really think about, and that's why I think that gets back to the idea of meeting people where they are, and yeah, just empowering them as much as we can that way. Um, yeah,
Yeah,
very
no,
good. Go
yeah, I
ahead,
think
please.
you're absolutely right about like just like different. I mean, the small little things, right, that people don't consider when creating like sorry. You're absolutely right about the small thing, not small things. There's so many factors that play into someone's ability to make a doctor's appointment or to show for an STI test. Like even if you're in school, right? If you're a student, you may not want to miss a class because while you can say that like okay, like I I had a doctor's appointment, I need to go to class. What if it requires a follow-up and the follow-up is 2 days out and that just happens to be the next time you're taking that class, right? So it's Tuesday, Thursday, or Monday, Wednesday. So you're also missing that class again. And then again, another class is missed, right? So there's so many factors that people don't, that's not, I'm not saying that people don't take into consideration, but there's a lot of factors that you don't immediately think of.
Right, right, exactly. Yeah, everybody thinks in terms of money and having insurance and the ability to pay for care. But even if you have that, just still getting to the appointment can be hard, just like you're talking about. People are busy. There's a lot of competing priorities, and sometimes you have to give up one thing to pay attention to something else. And
Mm,
unfortunately, healthcare providers, using our healthcare services, that sometimes that's the first thing to go.
yeah. Or if copays exist, I mean, like, yeah,
Yep.
copays are like crazy. When I was a student in college, like, I was lucky to have money to buy like a pack of Fit Newtons. So
Right.
like yeah,
Right.
yeah. So even
Yeah.
if it's like the student health center, it's still like the copay for medication still exists. So there's so many things, right?
Yeah. Absolutely. My last question was going to be any suggestions on how somebody might become their best advocate in getting the care they need. But you really addressed that earlier when you talked about the importance of really understanding what say for example Doxy PEP is and why
Mhm.
somebody might need it, what the benefits are, what do they need to know about the follow up. Just simply having that grounding before you even go into the healthcare visit. Because, like I said, an informed patient is an empowered patient,
Mhm.
or at least that's a big piece of it.
Mhm.
Yeah, and part of what we're doing, we're always, whenever something like this comes along, we always put out, we write a blog article, we put out some social media, we put an FAQ on the website, and those things are great, but the missing piece is having a conversation with someone like you. That's the missing piece. I think we need more of the community to sort of lead the effort. I think we need people who have actually gone through this, can speak, because just in this conversation, you've taught me several things I never would have thought about. And so
Mhm.
that's why we need to talk with folks like you and have you really sort of, take the lead in a lot of ways, because you have an authenticity that somebody else may not, and that's why I'm so glad that we took time to talk today. Yeah,
And thank you. I mean,
yeah.
yeah, thank you so much. I
Oh
really
yeah,
appreciate having this conversation. And to your point about, like I about what someone can do to feel empowered. I know I kind of answered the question already, but I mean, it made me rethink about it too. And it's just like recognizing that, there are systems of inequality like that exist in the United States, right? That's undeniable, right? Especially in healthcare settings. And knowing that myself, that I'm Black, I'm gay, I'm young, a lot of these things are stacked up against me. And knowing that, like, in order for me to get justice for myself, like, I'm going to have to, like, go to the table, knowing what I need to know so that I can get the things I deserve to get. You know what I'm saying? And like, I think for people, I mean, it's difficult to, like, to to maybe make that first step because you're supposed to be able to trust your doctor. You're supposed to be able to, I mean, I think people believe that their doctor knows like what's best for them, and they know that like all the things that it requires to be a doctor, right? Or to be the person treating you. But sometimes they don't know things, right? And it's okay for you to say like, I know what's best for me. I know the things that I qualify for. I know that I should be getting these things. I know that this is best for me, and it's about my health. So I'm gonna bring it to this doctor, let this doctor know that like this is what I need and this is what I want. And just fighting, like having that fight for yourself is like
Yeah.
what makes the difference,
That's it. That's it. You know what? You just gave me the sound bite to end all sound bites. I love that. That
Mhm.
sums it up perfectly, and I think
Mhm.
that really captures it from both sides. Uh,
Mhm.
Jaylan Daniels has been our guest today. Thank you so much for your time. I know this is very personal for you, and it's great to have insights, like I said, from someone with so much direct experience. I think this will be a real value to others who are either starting this path or they're considering it. Jaylan, thank you so much. I do appreciate it.
Thank you so much, Fred. It was a pleasure talking to you.
Likewise. So let me mention again, we have a podcast we did with Dr. Philip Chan, who is a co-author on the CDC guidelines, and he offers insights into why the recommendations currently are just for men who have sex with men and transgender women. But he also speaks to the promise of Doxy PEP with other populations. So we'll link to that in the show notes if you'd like to dive into that background. And thank you, intrepid listener, for tuning in. Check back with us. We'll have things like this, great conversations with other thought leaders like Jaylan. We'll have new resources. Please send feedback if you have any ideas for future podcasts. Info@ashasexualhealth.org. And until next time, take care, everybody.